pretty normal occurrence. You have a big presentation or something and you get just a little bit nervous. But when you feel those flutters in your chest, that could be a sign of a much bigger problem, one that could potentially lead to a stroke. Joining us now is Dr. David Rose. He is here with us. Good morning. Good to see you, sir.
Good morning to you. How are you?
All right, so you say this is something that could potentially be AFib. So first of all, before we talk about what that diagnosis could lead to if left undiagnosed, what is AFib?
What is AFib? It's a great question. AFib is a heart problem. It's an electrical irregularity in the heart. So the electricity of the heart is irregular. Your heart starts to beat irregularly, and therefore blood can pool and clot inside the chambers of the heart and flick off and go to the brain and cause a stroke. And that's what I do. I'm a stroke doctor. So all I do all day, every day is see patients with stroke. And a lot of times it's from atrial fibrillation causing it and clogging a pipe in the brain causing the stroke.
Okay, so let's talk about the difference between something as simple as I mentioned before, just a flutter in the heart, it might be nervousness about giving a presentation, versus warning signs and symptoms that it could be leading to a stroke. How do you know the difference between the two?
It's a great question. You know, stroke is a brain problem. So you'll have a clogged pipe in the brain, for example, decreasing the oxygen to a part of the brain and therefore causing symptoms such as facial droop or arm weakening or slurred speech. And what happens is that in atrial fibrillation patients, you have an irregular heartbeat. So 50% of the time, you'll feel this very fast beating in your heart, much faster than it should be, without the associated anxiety that you would feel, let's say, if you're giving a presentation when your hands are clammy and you feel like you're anxious. Whereas AFib, you could just be sitting on your sofa and all of a sudden your heart just automatically starts racing and you may feel lightheaded, you may feel dizzy, like you're about to pass out, etc. That could be atrial fibrillation. Or 50% of the time, AFib has no symptoms whatsoever, and then it'll just flick off a clot from the heart to the brain and cause a stroke, and then you would have symptoms.
Wow.
So
right.
There it is.
Yeah, so it's important to be knowledgeable about your health. If you notice anything, obviously get to the doctor right away. You know, be in control of taking care of yourself. So let's talk about some of the risk factors that lead to AFib, some things that people could be doing right now, if possible, to try to ward off AFib and potentially a stroke.
Right, so if you have AFib, you probably should be on a blood thinner to prevent a stroke. But in terms of preventing AFib, some folks are just born with the genetics of going to have it later in their life, and a lot of times you just can't avoid it. But of course, if you have something like, for example, blood pressure, hypertension problems, certainly that could over time lead to this. So you got to know what your blood pressure is. Cholesterol problems, you got to know what your LDL, bad cholesterol, is and keep that under control. And of course, if you're a smoker, I'd advocate to you to stop smoking, because that too can lead to this diagnosis. And then of course, if patient has AFib, they can have a stroke. They're 5 times more likely to have a stroke than patients without atrial fibrillation. So know what your risk factors are: hypertension, smoking, cholesterol, and get them under control so you don't have to develop this. But of course, if you have the genetics for it, you may get it anyway. And if you do have atrial fibrillation, try to take a blood thinner if you can to prevent a stroke.
There you go. All right, Dr. Rose, so good to see you this morning. Thank you, sir, for your time and your expertise.
My pleasure. Thanks for having me.
And we appreciate them for sponsoring our segment. We will be right back.